Welcome to Disability Rights South Carolina University. This session is called Abuse, Neglect, and Exploitation 101. Our speakers today are Charmaine Fuller Cooper, who is the State Director of AARP South Carolina, and Rebecca Spanigal, one of the attorneys here at DRSC. A few things to go over before we get started. Everyone, this is being recorded and will be put onto YouTube after the fact for others for their viewing. Please make sure you do not share personal information as that would be made public. We do ask that you mute yourself. We will have time for question and answers at the end of the session, at which point you can put them in the chat or raise your hand. And this is our last session for 2023. So we will have more sessions next year that you can be on the lookout for. I think that is about everything. So I'm going to give it over to Rebecca to get started today.
Good afternoon, everyone. I hope you all are doing well. Like Maggie said, my name is Rebecca Spanigal, and I'm an attorney with Disability Rights South Carolina. I'll just briefly introduce my co-presenter. Her name is Charmaine Fuller Cooper, and she is the State Director for South Carolina AARP. Next slide, please. So I wanted to go over very briefly DRSC's mission statement. So we exist to protect the legal, civil, and human rights of people with disabilities in South Carolina. We do so by trying to enable people to advocate for themselves first and foremost, but then when individuals need help, we advocate on their behalf, particularly in situations where they've been discriminated against or denied a service to which they are entitled. We also engage in educating the public through sessions like today, stakeholders and policymakers about laws that protect individuals with disabilities. And we work to promote policies and services that advance those rights and interests. Next slide, please. So a little bit about Disability Rights South Carolina. We are a nonprofit that provides legal-based advocacy to people with disabilities across the state. It's important to recognize that we are independent of any agency that provides services or treatment to people with disabilities. We are also the designated protection advocacy system for the state of South Carolina, which I'll discuss later, gives us special authority to be able to monitor and investigate facilities in particular, along with providing those advocacy services. We are one of 57 PNAs. There is a PNA in every single state. So if you're ever in another state, you can always contact the protection and advocacy system for that state as well. Next slide, please. Okay, so moving on to our subject matter for today. I wanted to start by going over some basic definitions of what we're talking about. And it is important to note that different laws define these terms slightly differently, but generally speaking, these are the general ideas for each of these areas. So next slide, please. We'll start with abuse. What is abuse? Abuse generally is going to include any inappropriate treatment of an individual. So you can think about some more of the obvious examples, so to speak, of physical abuse to start with. So any hitting, slapping, biting, choking, those types of incidents, but also keep in mind that improper restraint of an individual can constitute physical abuse. That's particularly going to be in situations where a restraint is implemented inappropriately and it results in somebody being injured. That can also be a form of abuse. Importantly, there's also psychological or emotional abuse. So any threats, insults, harassment, or intimidating behavior of an individual. And this could be verbal or nonverbal. I've seen situations where just a person's body language scares an individual, and that does constitute an incident of emotional or psychological abuse. Lastly, of course, there's also sexual abuse. So any sexual contact without an individual's consent, and that's going to include situations where the individual is unable to give consent. But keep in mind that this also includes any photos or recordings of an individual without consent. Next slide, please. Neglect is a broad concept. Generally, it's the refusal or failure of a caregiver to provide for an individual's needs. So again, I think there are some more obvious examples, but maybe some examples that are not quite as obvious. So First of all, of course, if somebody's being withheld from being able to access food or water, clothes, healthcare, shelter, supervision or personal hygiene, that can be incidents of neglect. But some laws actually include in their definition the failure to establish or carry out an appropriate treatment plan as a form of neglect. And we'll talk about later some advocacy tips in this area, but again, it's just important to keep that in mind in an area where the individual or a family member can be involved to try to prevent that from occurring. Neglect can also involve the failure of a facility or program to maintain a safe environment. So that can include preventing peer-on-peer incidents. Now, it is important to recognize that not every situation of a peer-on-peer incident is automatically neglect, but if there is a pattern where those types of issues are reoccurring, it can evidence that there may be neglect occurring in the facility. Generally because the staff are not supervising the individuals in the program appropriately. Similar to that, it can also be a situation of neglect when a facility or program fails to actually appropriately train their staff. Again, I'll use restraints as an example. If you have a staff member that is implementing a restraint that hasn't actually been trained to do so, that can constitute neglect as well. Next slide, please. So lastly, we'll talk about what is exploitation. So generally speaking, it's any situation where you're taking improper advantage of an individual. So the two main categories are financial exploitation or labor-activity exploitation. So for financial exploitation, you can think of, again, some more obvious examples where somebody is improperly, illegally, or using an individual's funds without their permission. But it can also happen in situations where you have a power of attorney, a guardianship, or a conservatorship at play. The law provides that individuals who are acting on another individual's behalf in these relationships have a duty to act in that person's best interests. And sometimes if it's, again, in egregious situations where they're clearly not acting on that person's best interest, or they're using that position to take funds or take property or anything like that, that can also be a situation where exploitation is occurring. Labor activity exploitation, again, is just causing somebody or requiring somebody to engage in work or any activity that is against their wishes. On the more serious side, of course, that includes sex trafficking. But, you know, I think with that, just keep in mind that there are situations where an individual is required to engage in activity as part of a treatment plan as a program, but it should be clearly defined in that treatment plan, and it shouldn't be a situation where it's just purely against that person's will and not written out in that plan. Next slide, please. So we're going to move on to identifying potential abuse and neglect and exploitation. And let's move to the next slide. We'll start with just some general tips about how to handle suspected abuse and neglect. Again, these are more like advocacy tips. But I do want to emphasize from the start that if it's an emergency situation or you are just unsure of what to do, it's never going to be wrong to make a report. And if you're not sure who to report to, contact local law enforcement. Just please keep that in mind as we're talking about some of these advocacy tips. But if you're in a situation where you're trying to address suspected abuse and neglect directly with a facility or program, these are just some thoughts on how to do that. So first of all, it's important to keep records and documentations regarding your concern. Some examples, sometimes I've had families that provide a timeline of what's been occurring. That can be extremely helpful. It's also really good to keep emails back and forth between you and treatment team members about what's been happening. And related to that, if you suspect abuse and neglect is happening and it's, again, not that emergency where you feel you need to make a report and you're trying to advocate for for yourself or for your loved one, discuss it with the care team, talk about it, ask questions. What happened? What are you doing about it? How are we going to prevent this from reoccurring in the future? And you can also request documentation regarding your concerns. Certain types of incident reports can be made available to the individual. But again, all of that being said, if you're unsure, it's an emergency, or it just, again, it's never going to harm you to make a report so that you are acting to protect yourself or your loved one. Next slide, please. So we're going to go through and talk about some signs of abuse, neglect, and exploitation. And again, I think some of these are intuitive, but just I'll try to highlight some of the ones where that might not be as obvious. So first of all, with signs of abuse, on each of these slides, I put an individual's report because I think it's important to emphasize that you want to take every report that an individual is making very seriously. I do understand there are situations where an individual may make a false report, but goodness forbid you don't take that report seriously and something is actually occurring. Just to please keep that in mind. Of course, if you're seeing physical injuries, unexplained bruises, unexplained scratches, injuries, sometimes the technical term for it is injuries of unknown origin, those can be signs that abuse may be occurring, and you may want to start asking the facility or program some questions. Also, individuals' reaction to abuse can vary, but if you are seeing that your loved one is exhibiting uncharacteristic behavior, and I think the key term there is uncharacteristic, you may want to have a conversation, of course, with that individual, but if they are scared or not willing to make that report to you, start asking the facility or program questions about what's been happening, and if there are anything, if there's any concerns there. Next slide, please. Some signs of neglect, again, an individual's report, if the individual says they're not getting their medication on time, that's going to be something that you want to follow up on. Poor care or hygiene. This is something where I sort of draw on my personal experience as a caregiver for medically complex siblings. If I am looking at my sibling and it's very obvious to me that their teeth are not being brushed, their face is not being cleaned, their hair is unwashed, those are all things that I, if my sibling was in a program, I would be contacting the staff and trying to have a discussion about what's happening there. Unattended or untreated health problems, again, sort of drawing on sort of the medically complex, for folks that have medical complexity. If you're seeing a situation where an individual is developing bed sores because they are not being transferred on a daily basis or something like that is happening, that can be a sign of neglect as well. Lastly, any hazardous, unsafe, or insanitary living conditions. Again, when you walk into that facility, if you're seeing things that are dirty or otherwise concerning, that can be a sign of neglect as well. Next slide, please. So some signs of exploitation. Again, an individual's report, either that their finances are not being handled appropriately or they're being forced to participate in those activities that are not part of the plan of care that we talked about earlier. If you also see changes in that individual's banking accounts, banking practices, or other legal documents that are, again, uncharacteristic of the way that individual handles their personal matters, that can be a sign of exploitation. Lastly, if the individual is not being cared for appropriately and there are financial resources available, that can raise the question of whether or not exploitation is occurring as well. Next slide, please. Okay, so I talked before about the fact that if you are concerned that you should always consider making a report. So we're going to go through and we're going to talk about the different entities in South Carolina that are tasked with investigating allegations of abuse and neglect. But again, I want to make sure that I emphasize that if you are in a situation that is an emergency or you're not sure who to contact, please contact local law enforcement. Next slide, please. You can also contact us if you have a question about who to report to. I did not list the contact information of every one of these entities on these slides just to keep it, make sure that it was easy to read. But if you ever have a question about who to call or what that contact information is, you can contact Disability Rights South Carolina as well. So for children that are being treated in a facility or a group home, the Department of Social Services operates a division called the Out-of-Home Abuse and Neglect Division, and they are mandated with the responsibility to investigate allegations of abuse and neglect in facilities that they do not themselves operate. And they're tasked with investigating abuse and neglect in those settings. So an example of that is going to be a psychiatric residential treatment facility, which is a mental health setting for children under the age of 21. So if you have a child that's in one of those facilities, you can call OHAN, but you can also call the Department of Health and Environmental Control, because they are the licensing agency for that. So you have two opportunities to make a report and have investigations of abuse and neglect. And of course, I will say that the focus of those investigations may differ because DHEC is going to be looking at compliance with licensing regulations. I think OHAN would be looking more at very strictly, whether or not abuse or neglect is occurring. But again, it doesn't hurt to make a report to both of these entities in a situation where you have a child in one of these settings. Next slide, please. Additionally, so if you have an adult that is in a nursing home or assisted living facility, you can call the State Long-Term Care Ombudsman's Office. That is a South Carolina agency that is, again, legally obligated to investigate allegations of abuse and neglect in nursing homes, assisted living facilities, and we'll talk about some other settings where they investigate. Similar to what I talked about with kids, because nursing homes and community residential care facilities are licensed by DHEC, you can also make a report to them. Next slide, please. So adults in DMH facilities, this is going to be predominantly if your loved one or you are receiving treatment in a psychiatric hospital. You can call the Vulnerable Adults Investigations Unit of the State Law Enforcement Division, or SLED. When you make a report to SLED involving an adult in a DMH facility, or we'll talk about in a moment in a DDSN facility, SLED may investigate that allegation themselves, or they may refer the case to the South Carolina Long-Term Care Ombudsman. It just depends on the type of allegation that you are reporting. So just be aware of that when you make that report, that it may be transferred to the Long-Term Care Ombudsman, but they are the ones to call with that concern initially. And again, because psychiatric hospitals are licensed by DHEC, you may also make a report to them. Next slide, please. So adults in DDSN placements, again, you can call the Vulnerable Adults Investigations Unit, and they will take that concern and either investigate it themselves or refer the case to the South Carolina Long-Term Care Ombudsman. You can also call the Department of Disabilities and Special Needs themselves because they are the ones that license these settings. So again, you have the opportunity to make reports to both SLED and the Department of Disabilities and Special Needs. Next slide, please. So we talked a lot about facilities and placements, but of course, a lot of our individuals and family members reside in the community. So if you ever have a concern that somebody is being abused in the community and they are a child or a vulnerable adult, you can call the Department of Social Services to report that abuse or neglect. Next slide, please. And certainly we don't want to forget Disability Rights South Carolina. You can always call us to make reports of allegations of abuse for individuals that are receiving services in a facility or a program. We always encourage family members or individuals to make those reports to the appropriate agencies first. But if you have a concern about, like I said before, if you don't know who to report to, or if you even have a concern about the investigation that agency is making, you can contact us. Disability Rights South Carolina has unique legal authority to be able to go in and actually monitor the settings, so we can go and visit and look at all of the different areas of a facility or program at any point, but also in the context of investigating allegations. And we have some broad authority to be able to conduct an investigation as well. So again, it's really important to consider making reports to the appropriate agencies, but you can always contact us as well, and we can follow up on your concerns. Okay, next slide, please. The last thing I believe that I'm going to talk about today, before I turn things over to Charmaine, is just some general tips about choosing a program or facility. And I'm sure that this is not an exhaustive list by any stretch of the imagination. I'm sure some of the professionals on this webinar would have additional suggestions. But these are just some of the things that I thought about as I thought about, if you are a family member and you're trying to make a decision about where you would like your individual to receive services in the community, in a facility, in a placement, what are the things that you should consider? Next slide, please. So again, just some general advocacy tips here. Do your research. There are some publicly available data from the government regarding certain types of facilities. This is particularly true of nursing homes. The federal government publishes a lot of data about the performance of individual nursing homes. So you can go ahead online and do that research. And there is a lot of publicly available information about several different types of facilities. But I think it's really important to make sure you also request a tour or visit of the facility prior, so that you can look at where the person is going to be living, where the person is going to be receiving treatment, and get a sense. Of course, you're not going to get a complete sense, but get something of a sense of how you feel about the services that facility or treatment program is offering. The next one is just, I often run into situations where folks are sort of boxed into, it's either a decision where it's either this facility, this placement, or we don't have anything else available to you. Sometimes practically you do have to think about the fact that there may not be beds available in another facility, and that this may be the only option, but I really try to encourage people to remember that you can decline services if you are not comfortable. And there may be a really justifiable good reason to decline services if you've gone on that tour and you've seen something that concerns you, or if you've gone on that visit and you don't believe that the facility has everything that you need to be able to live there safely. Those are reasons that are completely understandable for why you should decline services. Lastly, I think it's important, this is mainly to, I think, family members, but also professionals, case managers, and things like that. Please remain involved in that individual's care. Monitor, try to go on visits as much as you can, talk with the treatment professionals, participate in planning meetings and all those sorts of things. Those can be huge steps to prevent abuse and neglect from happening to an individual that's at those facilities. So on that note, I'm going to go ahead and turn things over. If you could go to the next slide, please. I'm going to go ahead and turn things over to Charmaine. Thank you.
So thank you, Rebecca, and thank you to the Disability Rights South Carolina team. Next slide. So at AARP, many people may not be familiar with our founding, but we're celebrating our 65th anniversary this week. And when our founder, Dr. Ethel Percy Andrus, came up with the notion of founding AARP, one of the key things she always said was, what we do for all. And that is why I'm here this afternoon with you, of that focus of what we do for all. And people over 50 experience many of the aspects of things that are related to ableism and aging and age discrimination and disability discrimination. So I'm happy to be with you here today. What is AARP's policy as it relates to our program today? Where our policy book states that dignity and respect free from discrimination, that's the focus. So older adults, like everyone, have the right to be treated with dignity and respect and to be free from discrimination. However, many older adults face age bias and discrimination in the workplace and other settings. Moreover, many older adults may also experience discrimination based on race, class, disability, or sex. And that includes sexual orientation or gender identity, or a combination of these aspects. The intersection of ageism with other forms of discrimination often multiplies and compounds the harmful effects of discrimination. It can affect a person's physical, mental, and financial well-being, as Rebecca went over a little bit prior. Next slide, please. So what are some of the other things that AARP's policy focuses on? And a key piece is protections. Our policy states that some older adults may need extra protections. For example, those with cognitive impairments or other health challenges may rely on friends, family, or paid caregivers to complete day-to-day tasks. Some are unable to care for their personal and financial needs. They may have a court-appointed guardian or an informal caregiver handling their finances. In most cases, caregivers and guardians uphold the dignity and wishes of the person they are caring for. However, we know this is not always the case. Thus, oversight and protection are needed to ensure that older adults being cared for by others, including those under guardianship, are treated respectfully. They should live free from all forms of abuse, including neglect and financial exploitation. So what are some of the things that AARP works on, and what are some of the resources that we have in the community? So one key thing that we really focus on is education and awareness. And as you can see, our education and awareness overlaps with policy and advocacy. Key things that we're looking at as we go into 2024 include housing. We truly believe at AARP that regardless of your status in life, regardless of any issues that you may be experiencing, that everyone enjoys the right to live freely in a community and to not be discriminated against or to be forcibly segregated into a community because of any type of disability status. And that necessitates the need for a formal state homestead plan here in South Carolina. Some of the other things we're seeing with housing is issues dealing with accessibility and affordability so that people can truly age in place and choose the setting that they want to be in. Another policy issue that we're seeing is transportation. South Carolina's funding formula for transportation has not been updated in 40 years. And this has a trickle-down effect, whereas those in local communities are unable to get service providers to provide transportation, which causes the effect of people who need transportation, there's not accessible transportation, your wheelchair may not fit on the van that comes, the hours may be limited, and in very horrible cases where people have been left overnight, unable to get transportation. This also leads to social isolation when people cannot freely and independently move around. Another key policy issue that we're concerned about is work and jobs. So AARP has a program called Age-Friendly South Carolina Businesses, which allows us to go out and have businesses take a pledge to be age-friendly. And you may ask, well, how does this relate to persons who may have disabilities? And that's because one of the key issues in asking for age-friendly workplaces is the need to ask for accommodations that those workplaces are accessible, whereas it's handrails, zero elevation footing, and those types of things. And so those are areas that we have intersections that can be friendly to all communities. Caregiving is another essential piece. Former First Lady Carter once said that you'll either be a caregiver, need a caregiver, or you're currently caring for someone. And I paraphrase that, and I probably totally messed up the quote for you today, but you get the point that caregiving is essential. At some point in all of our lives, we need someone to step in and assist. And some of you may be caregivers for listening to the call today. And so some of the things that we do at AARP on the education side is making sure that people have a caregiving plan, making sure that they know community supports and services in the community, but also making sure that they know about things such as respite care, because sometimes you get burnt out. Make sure that burnout does not lead to abuse and neglect for impacted populations. The other thing that we've worked on at AARP is South Carolina's long-term care report. And you can find, I have links to recommendations in a future slide, but those recommendations are essential because some of the things they point out again are housing and oversight, especially of our assisted living facilities in the state that don't have the oversight and regulation that many of us would like to see. The other key thing that we've recently worked on is a new social isolation report. And that social isolation report has really led back to key things such as people needing access to technology education, access to education on how to use that technology. I may have just said the same thing right there, but also access to housing and transportation. So it gave in those recommendations the need for really making sure that in order to avoid isolation, that access to that digital technology, accessible and affordable housing, and accessible transportation were some of the key findings that we saw. In terms of another policy, financial security, which Rebecca did a wonderful job highlighting, that we know that frauds and scams and financial abuses occur. We also know when it comes to Social Security and SSDI payments that many times people have representative payees who are in charge of handling their financial matters. And so for us, it's very important to make sure that we can prevent as much as possible frauds and scams as they occur. Protections, as both of us have mentioned earlier, are essential. AARP has worked in many of our states on things such as uniform guardianship and estate planning, policies to help prevent neglect and abuse, things such as fines and fees. We recently did a listening session in the Low Country, and one of the things that we found from that listening session that people shared is that they feel like they are frequently the target of excessive fines and fees, or being locked into long-term contracts for systems such as if you fall, that fall monitor might be a 2 or 3 or 4 year contract to monitor. And even if a loved one were to pass away, that whoever was responsible for paying the bill, they're sometimes on the hook for those fines and fees. So that's an issue that we are super aware of and looking into what are provisions that we can fix. Another thing that's come up quite a few times amongst our membership is related to the need for South Carolina to have an abuse registry, to make sure that we're not in a situation that we can prevent further abuse by simply knowing who was the one who was involved in the abuse in the first place and making sure they're not around you or your loved ones. Finally, voter engagement, which is probably something that you don't hear people mention as often. But as we look to South Carolina being one of the early presidential primary states, one of the key things that South Carolina is working on is making sure that we get issues in front of the candidate to make sure that candidates are educated, making sure that you as members and the public are educated, but also making sure that you know when, where, and how to vote. And a key piece of that vote is making sure that there are accessible voting locations, that everybody can vote, but also that you have the privacy that anyone else who's voting also has. Another part of voter engagement is that we know that there are many, many big policy issues, but we also know there's a significant block of caregivers who are providing care throughout the nation, whether it's for persons with disabilities, whether it's for Asian communities, or you name a lot of the intersections. And we want to make sure that caregivers are part of that designated voting block when people go to vote this year. And so we're elevating issues of caregiving and healthcare as we're going out and speaking with presidential candidates, along with financial security. Next slide, please. So where can you find a little bit more information that helps us improve the policies and the way that people live and go about here in South Carolina? Much of the things that we do at AARP South Carolina are free. And so I want to encourage you, one, to look at our free Livable Communities virtual workshop that's coming up next week. They're 2-day workshops. They go from 1 to 5 p.m. on September 27th and September 28th. Much of those workshops will focus on housing, accessory dwelling units, best practices that we're seeing in different local communities, statewide, and even at the federal level, and having real people and real stories sharing how they've gone about making policy changes so that their community is livable. You can also find this link where the slides are shared. You'll be able to click on this link right here, and you'll be able to register for free for those workshops coming up. And I invite you to participate. Another resource that I mentioned was age-friendly South Carolina businesses. We have the link right here. Caregiving, a huge piece of AARP's work. You see that link at www.aarp.org/caregiving. The wonderful thing about this site is that you can actually go online and you can pull down videos of how to do things such as how do you safely lift a loved one so that you don't hurt yourself and so that they're also not hurt in the movement process. What if someone has a wound that you need to keep an eye on? How do you go about doing wound changes? So it's a wonderful site that you can see the how-to videos. You can have support services for if you're experiencing certain dilemmas with housing or accessibility. Just an excellent site to go to. Next slide, please. I also mentioned 2 reports previously, and those were the Institute of Medicine and Public Health's social isolation report and also their long-term care report, which AARP supported both. And you can find the recommendations and findings and presentations that help to contribute to those reports at the link that I've included on these slides. I also mentioned fraud and abuse, and for AARP has a fraud hotline. This does not take the place of calling 911 or your local law enforcement provider if you ever feel that there's abuse or neglect. But if you feel like there's a scam going on and somebody's trying to scam you out of your money, you're getting those phone calls that say, give me $100 to buy light bulbs and donate it to a nonprofit. Or you're getting those phone calls where someone says, send me a prepaid money card because you owe the IRS. Anytime you think you can possibly have been the victim of a scam, feel free to call this toll-free number for more information or referral to another agency. But by all means, if necessary, please call 911 or law enforcement first. I mentioned voter engagement. Our South Carolina Elections Commission, if you have questions about where to vote and when to vote, if you have concerns about accessibility and having privacy when you're voting, please visit the scvotes.gov site. And lastly, if you have any questions or concerns or want to get in contact with AARP, I've listed our state website here, which is www.aarp.org/SC. I think that's all the slides that I have for you today, but I do encourage you to reach out. Again, our information is also listed there as well, and I encourage you to reach out if you have any questions or concerns. Rebecca, back over to you.
All right, thank you so much, Charmaine. I enjoyed hearing the information that you shared with us. So if you could go to the next slide, please. My contact information is on this slide. Our helpline is also listed. That's the number to call that I mentioned before. If you ever have any questions about, abuse and neglect of a loved one or yourself. I also should mention that our website there has a wealth of information. We produce what we call fact sheets that just provide some basic information about a variety of different areas. One of those being abuse and neglect. So there are a few fact sheets on the website on that topic that go through a lot of what I talked about today. In addition, just want to also briefly mention that our website provides information not only about what we do generally, but also just want to highlight our representative payee program. We have a program where we have a contract through Social Security to monitor representative payees, both organizational representative payees and individual payees. So there's more information about that program and how you can make a report to us about a concern with representative payee. So on that note, I think I'm going to turn things back over to Maggie so we can start some question and answer.
Yeah, thank you, everybody. Thank you, both of you, for speaking for us today. We will go ahead and open up the Q&A, and if you want to raise your hand or type into the chat, we have, I believe, about 15 minutes, maybe a little bit longer, to go over any questions you have.
Really quickly, I joined late. Sorry, y'all. I think I joined on time, but I didn't join the audio, so I didn't hear that piece. Are y'all sharing these slides that you put out today?
If you would like to email me, I will put my email in the chat. You can email me and I will send you a copy of the presentation.
Perfect. Thank you.
Any questions? All right, well, it looks like you guys were extremely thorough. I do not see any questions or hands raised. Rebecca, Charmaine, do you have anything else you want to add before we end the session today?
I think I'm good, Maggie, but thank you all for those who logged on for attending this session. We really appreciate it.
I concur with Rebecca. Thank you for the opportunity.
All right, well, thank you guys very much. And again, if you email me, I'll be glad to send you that presentation, and we will be putting the video on YouTube so that it can be shared as a resource in the future. And thank you, everybody, and have a great day.